point in the middle. All right. Sterility. Of course, what has to remain sterile on a syringe? The needle. And you want to make sure the inside of the barrel where the medication will remain sterile. So you're not going to be doing this and doing that and then doing that, because that's going into where your medication is. Okay? All right. What else do I want to say? Vial. Ampule.
Do they still use ampules?
What is this?
Vial.
What is this?
Vial. Vial. Vial.
Ampule.
Okay. The vials can all be used more than once. You'll continue using them over and over again to withdraw medication until either it's expired, empty, or the clarity is no good anymore. This is a one-time only. Take out your medication, throw it into the sharps containers made out of glass. Once only. Okay? These have a little vacuum seal in them. So before I can withdraw medication,
Put air in it.
you have to put air in it. Now, I know when you come into practice, these are going to all make liars out of me because they've been used so many times, it doesn't have that same vacuum that your new ones will have. Okay? But in reality, when you go to the facility, you do have to first put air in and then take it out. If you don't do that, I opened up a new one, but I'm sure by now it's no good. If you do not replace the air first, see, it'll just keep sucking back up and you'll never be able to get the medication out, in reality, okay? So the doctor wants me to give 1 cc of medication. Let's do a half a cc. Half a cc of medication. I'm going to first pull back to half a cc on my syringe, okay? Do your checks. I'm not going to go over this again. It's going to be the same thing as we did for Meds A. Your 3 checks, you're preparing. All right, expiration date, clarity of medication. Always clean the top off with alcohol. You do not need gloves to prepare your meds. Okay, so you're gonna first put your half a cc of air in here, turn it over, withdraw your med. I want all the bubbles out before you take this out of the vial. Don't take it out of the vial, then get rid of your bubbles, then go back in again and take out some more. It has to all come out first. I don't care if you pull all the way down past the half a cc, play with the bubbles, then push back up and withdraw. All right? Fine. As long as you stay in there, you can do anything you want. Recap. Only time I recapped, I'm not going to walk down the hallway with my needle uncapped. When would I not recap this?
After you give it.
After I give it to the patient, okay? This comes off and on, so do make sure that this is on tight before you try to withdraw your medication, because otherwise if it's loose, you're going to just be pulling out air bubbles. All right? So just make sure you give a little nudge to make sure it's tight. All right. Gloves here. You know what?
No gloves
I'm
here.
probably unprepared today.
Whatever.
Really? Oh, no, hold on. This is the room I used on Monday, and they came in and took all my stuff. All right, now we're going to give it. Okay? You never want to use a site that is bruised or impaired in any way. You always want to pick an alternate site. Also be aware of what site we used last. On the med sheet, there should be a little code identifying what site was used for the last injection. So you want to, if you can, alternate sites. Some patients prefer the same site over and over again. That's fine if the patient's awake and oriented and wants to do that, but otherwise try and alternate the sites, okay? All right, this is a regular IM injection. You want to go in and do your whole pre-protocol, okay? We're going to clean the area with alcohol from inner out. Remove the needle. We're going in for an IM at 90 degrees. 90-degree angle. Make sure you keep about 1/8 of the needle exposed in case, God forbid, it would break off. You have something to grab to pull it out. Steady the syringe, and you want to aspirate. You want to pull back 2/10 of a cc to make sure there's no blood. If there's blood return, it means you're not in the muscle and you're in the blood vessel. So you're not giving an IM, you're not giving an IV. All right, so always pull back and check for blood return. There should be no blood return if you're inside the muscle.
How much would you pull back?
About 2/10, what I just showed you before. If you do get blood return, you remove the syringe, you get rid of it, you go back to the med room, and you start over again with preparing the med. Otherwise, no blood. Go ahead and give my injection and remove.
You said pull up 2/10.
This way. Okay? Sharps container. All right, gloves off, hands washed, document. Now we're going to do a Z-Track, which is also an intramuscular injection. It's just another way of giving the IM. A lot of medications like Infron are irritating to the skin. I don't want this one. So what a Z-Track will do, it's given in a way so you're pushing over the muscle, giving the injection, and snapping the muscle back in place so the medication is not rising back up towards the skin and irritating it, okay? So a Z-Track is also an IM, it's just given in a Z-Track method. All right, ampules. Make sure you knock the medication out of the top because it comes filled with medication on the top, and then you won't have that medication on the bottom. Take a 2x2, cover the top. When I open it up, I'm going to pull back towards me. So then any shards of glass, it'll go that way, okay? Snap it. This goes into the sharps container. Now, for testing purposes, I don't care how you do this. Some students just feel more comfortable having it on the table and going in like this. I don't care. Just try not to touch the outer edge going in. But this is what I find when students are being tested and they're going into this little tiny ampule. Every time. If you turn this upside down and withdraw the medication, it will not come out. If I push air into this ampule, then my medication is pouring out all over me. And as the medication starts to drop in the little glass bottle, so should your syringe and your needle. It should always be covered by fluid. So if you have your syringe all the way up here to pull out medication, and the medication starts to drop, and your needle's still up here, what are you pulling out?
Air.
So just be careful that you're following the fluid. That's always, the needle's always in the fluid. Because once you run out of room here, you cannot push the air back up into here because then you're going to break the seal and all the medication is going to pour out on you. Right? This is the only one that you can go ahead and withdraw all the medication and then get rid of your air and your air bubbles. Okay? This is a Z-Track, so I'm either going to use a filtered needle to withdraw the medication, and if I go ahead now and give this to the patient and I don't want it to irritate the skin with this needle, I'm defeating the whole purpose of a Z-Track because this needle is